Healthcare in Singapore has progressed considerably over the years. When we achieved self-government in 1959 and then independence in 1956, we had the healthcare legacy of the British and our immigrant forefathers that included philanthropists like Tan Tock Seng, Gan Eng Seng, and Navroji Mistry. We improved upon the system which we inherited. In those early days, our focus was on getting the basics right: clean drinking water, proper sanitation, vaccination programs to keep infectious diseases under control, and strengthening our subsidized primary and acute services. This emphasis on the fundamentals nurtured a sturdy citizenry and contributed to nation building and economic growth. Over the years, the government introduced many sound policies to ensure that quality care remained accessible to Singaporeans while we kept costs under control. Prices were gradually adjusted to better reflect the true cost of healthcare provision. Generous government subsidies ensured that healthcare services remain affordable to all Singaporeans. This is done through tiered subsidies for different ward classes. We also set up MediSave, MediShield, and MediFund, or the 3 M's, to help Singaporeans pay their hospital bills. An important policy was to ensure co-payment to discourage overconsumption and overtreatment, which has become a problem in many advanced countries. This made for our economic competitiveness. It kept companies' healthcare costs down, and workers benefited as companies could pay them higher wages. Today, Singapore provides some of the best medical care in Asia. But our population is aging, and most Singaporeans are coming down with chronic diseases, a trend common to first world countries. These and other challenges will put pressure on our healthcare system. The government will continue to invest in improving the health of Singaporeans. We have built a hospital in the north to meet the healthcare needs of the growing population of this part of Singapore. We are also building a community hospital next to KTPH. Its operations will be integrated with those of KTPH so that patients can be transferred between the 2 hospitals depending on the level of care needed. This will lead to more cost savings for patients and a better allocation of our health care resources.